It's hour two of the Bold Republic Radio Show. My name is Glenn Woods. Thanks for joining me in hour two. But on a Thursday means we head on down to Cheyenne, Wyoming, where Charles Katibi from Wyoming Liberty Group is hanging by because apparently there's just, Charlie, great news when it comes to Medicaid expansion in the state of Wyoming. I can't wait for you to tell me.
What? Yeah, I don't. What good news is this? What good news?
I have no idea. I just try to make me happy about it. I'm not sure that you can. So
Sure,
the last I saw was a story, like a headline, something like that, Charles, that said the governor is still pushing his Medicaid expansion thing. That's the last I heard. That was just a couple of days ago. What do you got?
Yeah, well, what he's going to do is he's making the case right now that it will actually solve our budget problems, and it will actually allow us to pay less.
Okay, wait, let me guess. Our budget problem was that we had a little bit of a surplus, and he plans to put an end to that.
Well, the surplus ending is because of the fall in oil prices.
Oh, okay.
That is outside of our control completely.
Right.
What he's making the case for now is we could save about $10 million if we expanded Medicaid. That's the case that he's making, actually.
Okay, how in God's name does that work? What's his? I'm trying to picture the math and the logic on that. How would that work?
The argument that he's making is that we are spending right now in the state of Wyoming a lot of taxpayer dollars, state taxpayer dollars, on a bunch of separate, disparate healthcare programs for the uninsured and the poor. And this is the case that they're making in other states as well. They've successfully made this case. And the case that they're making is that if you expand Medicaid, the people that are currently using those programs will go on to Medicaid, and they will get their health care through federal Medicaid dollars and not through state dollars. That is the case that he's making. And it's completely ridiculous because we are still paying for federal taxes. We are still paying for these Medicaid through federal taxes. And the other biggest one, and people should remember this, if we expanded Medicaid, it will not reduce the amount we spend on these state programs. Because there's a really big state program that he's saying will save money on, and it's called Title 25. And in Wyoming, if you're a mentally disabled person and the authorities determine that you're a threat to someone else or others, the police can detain you and send you to a hospital for mental treatment and psychiatric treatment. And the state of Wyoming will pick up those costs. And what Governor Meade is saying, if we expand Medicaid, those people will go on to Medicaid, and we won't have to pick up those costs. But he's wrong. He's wrong because by law, Medicaid cannot pay for involuntary mental treatment and psychiatric care. So it's a complete myth that the governor and the Department of Health is peddling that will actually save money on this.
Okay. Now, the question that I always ask in something like this is, after I can understand if the governor comes up with his argument and he's just simply wrong, we're all wrong about stuff from time to time.
Sure.
So aren't there people around him saying Governor Meade about that and correcting him, or is it just not working?
I don't know if people in his Department of Health or in his office are actually doing that information or doing that data searching, because it's not like we don't know what the answer to this is. Other states have expanded Medicaid. Other states are dealing with an explosion in cost, and they're not seeing any of the savings that they were hoped for. 17 states have put out actual data on how many people enrolled. And on average, they've enrolled twice as many people. And they're dealing with cost overruns in the hundreds of millions. California has to pay $100 million more for this expansion population than they anticipated. Nearly every state has blown through all their estimates, and now states are actually contemplating having to cut other programs in order to pay for this. In Colorado, they enrolled 3 times as many people. And I was actually speaking to several Colorado legislators last week, and they said now they're having to consider cuts in higher education. Right. They're considering a $60 million cut in construction for transportation. So Medicaid is not free. States are having to pay a lot of money for it.
Yeah, see, and I'm trying not to beat a dead horse here, but I still don't understand why doesn't Governor Meade understand this when I know by now, Charlie, he's seen this evidence he must have. What's he stuck on? Besides stupid. I'm allowed to say that. You can't. What's he stuck on?
I have no idea. I honestly don't know what the health department is thinking either, because their estimates are completely based on how many people are currently eligible for the program. They are considering 17,000 to 20,000 people are currently eligible for Medicaid, and that's everyone making under 138% of the federal poverty line. That's what's going into their estimates. What they're not taking into account is how many people will decide to either quit their jobs or start working fewer hours in order to qualify for Medicaid and go into the program. Now, this may sound like fear-mongering, but this is the reason why states have blown through their enrollment estimates. The Congressional Budget Office actually put out a report on the work effects of Medicaid, and they estimate that by 2025, 5 million people will drop out of the labor force because of Medicaid expansion. Just because of Medicaid expansion, this is one part of Obamacare. 5 million people will either quit working or work fewer hours in order to get onto Medicaid. And that's what they're not taking into account when they say only 17,000 people or only 20,000 people will go into this program.
And then there's the flood of it. You got to include everything you just said, and also add what you said just a moment ago, all the people that are coming from other states pouring in looking for free stuff. So it's people taking advantage of all sorts of free stuff. Okay.
That's another thing to consider too. Yeah. There is no enforcement mechanism to speak of in any of these proposals that will actually have a residency requirement to actually require that you have to prove that you actually live in the state of Wyoming to receive our Medicaid funding.
Wow. All right. Well, and here again, has anyone gone to the governor and said we should have such a requirement? Has he rejected a requirement like that?
The people mostly that are paying attention, that are actually have a vested interest in this, are actually for Medicaid expansion. Right. I was actually at a forum on Tuesday, actually, that was conducted by Healthy Wyoming. Now, this is a coalition of some of the most powerful healthcare lobbying groups in the state. There's the Hospital Association, there was the Medical Association, Blue Cross Blue Shield. They're all sponsoring this, and they had nothing but rosy projections for this. They say it will cover more people, they will get more care, and it will cut down on the uncompensated care that hospitals are paying for. When even and I don't know why even they are on this side, because hospitals have not done better in states that have expanded Medicaid.
Well, yeah, and that's a whole different set of numbers we can look at, how actually doctors in hospitals, let's look at that for just a moment. So do doctors in hospitals do better under Medicaid expansion or worse?
Well, the case that they made was that they'll be more profitable overall. And the Moody's rating agency actually looked at the profit margins of hospitals in states that expanded Medicaid and the ones that didn't. And what they found was that, yes, the uncompensated care numbers went down, meaning people that had low enough income, they can qualify for free care from hospitals. That did go down. But the profit margins of those hospitals did not go down. And the reason why is because Medicaid is part of the uncompensated care problem. Medicaid does not pay its way at hospitals. If a hospital provides $10 worth of care to a Medicaid patient, Medicaid will only pay them for about $6 to $7 for that care. So they are losing money on every patient. So it's completely ridiculous for hospitals or anybody to assume that hospitals will actually do better under Medicaid expansion.
Now, that's hospitals. I personally know of more than one doctor that they either have stopped or they don't want to accept Medicaid anymore because they lose money on it.
Well, doctors, yes. Doctors at private practices, they can't afford to do this this numbers game where you shift the cost from Medicaid to private insurance, where if Medicaid isn't paying enough, they'll shift those costs and raise prices on people with private insurance. If you're a doctor at a regular primary care practice, you just can't do that. If you're a hospital like Cheyenne Regional, where you have a near monopoly on your customer base, you can do that all the time, which is why they have no problem with Medicaid expansion. They can always shift those costs onto private insurance payers.
So when someone goes to a hospital, and let's say during the course of the stay, they need they have a headache, and the nurse is going to give them a couple of aspirin. And they look at their bill, and what do you mean you charge me $50 for 2 aspirin? That's $25 in aspirin. That's the cost shifting you're talking about.
Well, yes, but the thing is that most people with private insurance will never actually see that bill. most people will never see their bill if they have private insurance. And that's why costs keep rising, because nobody looks at that bill and nobody ever criticizes it. If you're an employee and you have employer-sponsored insurance, you're never going to ever care to look at that bill. Yeah. You're going to pass that to your insurer, and the insurer will pass that to your employer. No one ever, and this is how this massive con game in our healthcare system keeps working. No one ever sees the full price. Taxpayers never see the full price. People with private insurance never do. It just keeps going on, and costs keep rising. And this is why we're in our mess.
And this is a big problem that I see with people. It's an out of sight, out of mind thing. Mm-hmm. They'll say, well, I only had to pay so much out of my deductible, so I saved a lot of money. Yeah, but what's your premium? And your premium continues to go up just for everything that you just described. I mean, so you are paying for this. So and I'm not trying to get off subject here, but like, for example, for women who want their insurance company to take care of their birth control. Mm-hmm. Well, okay, let's say the only time you saw the doctor this year was to re-up the prescription for the birth control. Mm-hmm. So, and I'm going to pick a number. You pay $800 a month in health insurance. Mm-hmm. So that's how much your birth control costs you, $800 a month. Well, if you had just paid for it out of pocket, you could have been at like $10 a month. So
that's Obamacare's great con game. Yeah. The idea is that if you require insurers to cover something with no copays, it's as if patients aren't paying for it. No, you are paying for it. You're paying for it in high deductibles and higher premiums. And if you're an employer, you are also paying for it through lower wages, because your employer is the one that's covering the cost. They have to get that. They have to pay for that from somewhere. And they're going to take it from either charging higher premiums from you or from lowering your wages. So you're completely correct in that regard.
Okay, well, here, let me go ahead and hit you with a number, because this is what we have to talk about next. I'm going to hit you with the number and then let you just sort of ruminate on it during the course of the break here.
All right.
18,882 billion. Now, that is a conservative estimate right now at where the national debt is, Charles. It's actually a lot higher than that. And you know very well if I say to you that ties into how we're going to get compensated through, the federal government on our expansion. I mean, that directly relates to it, but don't answer yet. Hang on, more with Charles Katibi from Wyoming Liberty Group.
Let's get back in there. Glenn Woods is back on the air.
And back we go down to Cheyenne, Wyoming, where I did a pop quiz on Charles Katibi from Wyoming Liberty Group. So let's have it. $18,882 billion is where we're going to be at 19 trillion pretty soon, Charles. So, why would we have a problem collecting from the federal government, Charles?
Well, you said it yourself. We are nearly $19 trillion in debt. Yeah. And now we think now is a good time to rely so much more on the government for this expanded new entitlement. That's what Governor Meade is saying. He's saying the federal government is a trustworthy partner in this Medicaid game, and it has the finances to actually fulfill this. And the bottom line is they completely can't. Last week, actually, just last week, Congress actually voted to defund Medicaid.
There was wait a minute. Okay, hold on. How does Congress vote to defund Medicaid? How does that work?
Because these are federal taxpayer dollars, and it's federal appropriations. It's money we pay into the federal government, and Congress has the final say over how that money is spent. If you just
defund Medicaid, it had to be a little bit more to it than that. Wouldn't that just leave a whole bunch of people out in the cold?
Let me explain this. This bill wouldn't have just defunded Medicaid. It would have undone about 2/3 of Obamacare. It would have done away with all the taxes it has, the individual mandate, the employer mandate, all those things. But it would have also cut all the federal funding from Obamacare. So it would have cut federal funding for subsidies on the private exchanges. But more importantly, it would have phased out federal funding for Medicaid expansion, the expansion part, over a period of 2 or 3 years.
Right.
And even while this is happening, Governor Meade is saying we can trust the federal government. That is what he's saying.
Well, that goes right up there with I'm from the federal government and I'm here to help.
Yeah, but
here's
the bottom line: the federal government, people in the federal government, have made no qualms about this. Congress does not want to pay for this. The Republican Party, which runs the Senate and the House right now, they have been against Medicaid expansion and Obamacare from the very beginning. Mm-hmm. They have no interest in paying for this.
Right.
Yet Governor Meade is saying that the federal government is a willing and able partner in this, when the bottom line is they have no interest in doing this, and they are not in any way more interested in funding Medicaid expansion than we are, the states.
Has there ever been a case, just tossing that out there, Charles, as another pop quiz to see what you've learned since you've been living in Wyoming, ever been a case where the federal government promised the states something, mm-hmm. and then turns out that they just were going to renege on it on second thought, and it was just a lie or a trick of some kind? Has the federal government ever done such a thing, Charles?
All the time. Okay. This is the thing about promises from the federal government. Yeah. If you enter into a contract with the federal government, they're the ones writing it, and they're the ones that can rewrite it. Bills from Congress are contracts that they can make with the states, an agreement where they say, we want to create these programs, and if you enter into them with us, we will pay for them. That sounds great. On the other hand, if, say, a couple years from now, the federal government doesn't like that idea, maybe they are against it or they can't afford to pay for this program, they can go right back to that contract, that bill, and pass another one and repeal it. So it makes no sense to get into bed or get into a partnership with an entity that can rewrite contracts whenever they feel like it.
Yeah.
And this is what Meade is trying to convince legislators in Wyoming is a good idea.
Okay, legislative body's in session right now. How is the legislative body responding to Governor Meade on this expansion issue?
So yes, he's trying to make the case that we'll actually save money. But even in the committee hearing where they heard the health department's budget request, which was to expand Medicaid, even they were saying, and I'm alluding to that program I mentioned earlier, Title 25. They asked the health department if the Medicaid program cannot pay for people with that are being involuntarily treated, how will this cut down on funding? And even one of the chairmen, Chairman Ross of the Joint Appropriations Committee, he was saying, "Could you please explain this to me? I want to make a coherent decision about this, and it looks like these are just fantasy savings." Even they are all fairly skeptical of if they'll actually gain in any way from this program.
Okay. Well, there's a good time if you can try to convince the governor, and I think it is perfectly worth it to get a hold of his office. We live in a population-wise small state, so it's a lot easier to get a hold of these people, but also get a hold of your legislators as well and see where they stand on this. And where, Charlie, do they find your work on this issue?
You can find my work at wyliberty.com. wyliberty.org. Oh, and another thing, the Joint Appropriations Committee will be taking public comment on this on Monday. So if anyone has any interest in this, they can go and let their voice be heard.
Thanks for chiming in, letting us know all of this, Charles. Always a pleasure.
Thank you.